If you are someone who's fallen and suffered a distal radius fracture and has had surgery, this video is for you. Oh, where's my marker? I was going to share with you. If you had a distal radius fracture, so very commonly called a wrist fracture, but it's essentially this bone right here. This is your distal radius. So this bone right here is this long bone. It actually is a bone that creates your elbow, but it comes down here and it's part of your wrist. If you have fallen on an outstretched hand like this and broken your distal radius and had surgery, you might see a scar down here like this. Sometimes there's a little zigzag right here that you might have, but majority of the time, if you have a distal radius fracture, you can have a scar that's right here. And most of the time, nowadays, they are repaired, by the hand surgeon, orthopedic surgeon using plates and screws. So they put a plate there and they capture all the little fragments and pieces of a fracture, and then after that, it really comes down to therapy. So, my name is Huang. I'm an occupational therapist and certified hand therapist, and I specialize in injuries of the hand and arm. And I see a lot of distal radius fractures. One of the most common questions I get is, how long does it take to rehab a distal radius fracture? So I'm going to speak specifically from surgery, because if you've had a fracture but you didn't need surgery or you opted not to have surgery, then that, like, your rehab recovery might just look a little differently. So if you've had surgery, then usually that means that they have stabilized your fracture, meaning that they put all the pieces together and they stabilize it with a plate and screws. Majority of the time, one of my favorite protocols that I like to follow, and this might be different depending on your surgeon. So I would highly recommend asking your surgeon what kind of protocol they follow, and just asking them doesn't mean it's disrespectful. I encourage all my patients to know what's going on with their injury. Ask those questions about what is the protocol they follow. Is your doctor a very conservative doctor, or are they a little bit more up to date with some of the protocols and the research finding that says, hey, if you have a stable fracture and you have a stable surgery, technically speaking, you're allowed to move right away. Some surgeons don't want to, right? They're like, even if I've had the surgery, I'm going to cast that person. It's their preference. But I don't think there's anything wrong with asking your surgeon, asking your therapist, what's the protocol? What are you allowed to do? What are you not allowed to do? These are common questions. As a certified hand therapist, I get these questions a lot because, I'm located in Miami. I have a clinic in Miami, and I am completely independent from surgeons. Like, I'm independent from hospitals. I'm independent from doctors. So I have my own opinions and I see what's worked and see what doesn't work over the, more than 20 years I've been doing this. So I don't think there's anything wrong with asking questions, and I actually encourage it. And I think more people should ask questions. So how, because everyone comes and they'll ask me those questions, and this is exactly what I say. Let's say, Huang, how long does it take to rehab? Well, technically speaking, once you are stabilized, you can actually come out of your post-op cast within 5 days. So one of the hand surgeons that I used to work with, this is what him and we did all the time. He would send me his post-ops. Like by day 5, I could take off the post-op dressing and I would make a splint, right? And then I would encourage them, okay, how do we take care of your wound? So we know what to look for, how to ensure it's closing right, that there's no risk and signs and symptoms of infections, right? And then we would start moving right away. So if you are broken right here, this is your wrist, that means you might not be able to move this part right away, but everything below and above it means like you're allowed to move. So one of the very first things we did was ensure that the fingers were moving right away. We made sure the thumb was moving, we made sure the shoulder was moving, we made sure the elbow was moving, right? So by day 5, we started to move, and we started to slowly progress. 2 weeks, 3 weeks, we could start to do gentle, active range of motion. You could turn your palm up and turn your palm down. So this is pronation, turning your palm down. This is supination, turning your palm up. We would gently move. There's a lot of ways in which you can gently move and not injure or do any damage to the bones, because the surgery ensured that it was stable, right? And then by week 4, you're allowed to move even more. And by 6 weeks, you're allowed to move even more. So between 4 and 6 weeks, that's where you're going to see majority of your clinical healing, meaning you probably by now go back to your doctor's office, take x-rays, or sometimes they take x-rays, sometimes they don't, just based on seeing what they did and hearing about your symptoms. They can see like, okay, you're healing really well, and we're allowed to step it up and start to gently push on the broken wrist, right? Because it's not broken, it's healing now. And then by 8 weeks, we're allowed to do even more. We're allowed to be even more aggressive. And what you want by 8 weeks is to have full end range of motion for your wrist, for your fingers, for turning your palm up and palm down, and making sure you don't have any shoulder problems. So by 8 weeks, you're allowed to fully move. You're technically allowed to move to end range, do some what's called passive range of motion to get you to the end range. And by 8 weeks, you're allowed to start strengthening. So it's not like, technically speaking, you can even start strengthening around 6 weeks. But strengthening means different things to different people. Doing strengthening with your hands is allowed at 6 weeks. You can start doing 1 pound, 2 pounds, 3 pounds at 8 weeks. You just don't want to do really aggressive stuff, like if you're a weightlifter, you're going to have to wait a little bit longer, right? But technically speaking, by 12 weeks, you should have full clinical healing and be allowed to do what's called weight bearing. So be able to push weight through your arms, right? So at 8 weeks, when you're getting out of bed and you put weight through it, it's not a problem. You're allowed to do that. If you're getting out of the chair, technically speaking, you can push yourself and get yourself out of the chair. At 12 weeks, you can put your full body weight on it, meaning technically speaking, if you're able to, you can do a push-up. But it might be really challenging because you're by now, 3 months later, your whole arm has gotten a little weak. So you're gonna have to work yourself up to being able to put weight through it. Being able to tolerate doing more than just one push-up, incrementally improving it from being able to put weight on it for 30 seconds, 1 minute, to doing 10 push-ups. So it's not like all of a sudden you can do it, but like incrementally over the 3 months, you're going to do a little bit more and a little bit more. That is in a perfect world, right? Technically speaking, how long does it take to rehab a distal radius fracture? Normal times are 3 months. I've seen people get so well by 2 months that they don't really need any therapy. They can just slowly strengthen on their own. And I've seen people struggle 6 months later, just trying to get end range motion. And it's because when you have an injury like this, there can be complications that slow your progress down, right? But from a technical standpoint, um, it can take you as long as 3 months. Normal average time, I would say, like I've been doing this for like over 20 years, and I have very small handful of people who have been so good that they were done before 3 months. Majority of the people take about 3 months, and then there's a certain pocket of people who just have complications. Now, Here, I'm talking about a very, wow, that was a big thunder. Um, there's variations in a distal radius fracture. It's not like everyone who has a distal radius fracture has the same type of break, has the same type of healing time, are doing it at the same age, are going to the same surgeon. There's so many different factors that for you, I would encourage you to talk to your, occupational therapist or certified hand therapist. If you have a little bit more of a complex case, just make sure you're going to someone who has some experience. A certified hand therapist is someone who specializes in treating hand and arm injuries, just like the one you have. So seek them out. Ask as many questions as you need so that you can feel really comfortable to understand how long is it going to take you, because everyone is so different. If you're in Miami and you have questions about your distal radius fracture and how long it's going to take you and what's going on and why you're not in that 3 month, technical protocol, you can certainly, give us a call here at Hands On Therapy Services and ask as many questions as you want. If you live in another area, then really do find someone that you trust who you can ask questions to and get answers. I encourage all my patients to find a therapist that they trust. I get lots and lots of questions because I also teach other therapists. So when I create videos and stuff like that for Hand Therapy Secrets, I have people who have injuries to just ask me questions, and I technically cannot give medical advice over social media. All I can do is, be a voice to educate. And I really do encourage, if you can't get questions from one, um, trust your gut and be okay getting a second opinion, to seeing why, what's going on with your case and how long it's going to take you and what are your complications. And that'll be another video that I make sharing different exercises and also complications to look for. So I hope this video helped you in terms of helping you just answer the question of how long is it going to take me? What is safe to do? So if you like this video and it's helped you, like it and leave a comment. Your questions help me to make better videos. All right. Thanks so much.